Thanks for watching, everybody. We're in Traverse City at Chronic Care Management. And with the state of affairs being in this country where we are kind of an aging population, a lot of baby boomers retiring and getting older, we're talking about palliative care. To my left, Jonathan, nurse practitioner. To my right, Julie Hardolt, nurse practitioner and owner. Thanks for taking the time.
You're welcome. Thanks for coming.
All right, quickly, let's talk about, because I don't know if a lot of people understand what palliative care is and means. So give me 30 seconds.
Of course. Palliative care is essentially symptom management. We take care of patients that have chronic illness and need attention in their homes. It prevents hospitalizations. So we often go see them for things such as coughs, pains, nausea, anything really that is a symptom that causes them distress.
Right. And you're a nurse practitioner. What exactly is a nurse practitioner?
A nurse practitioner is a registered nurse who has advanced practice training. We have master's degrees, and so we can practice in Michigan nearly independently. So we diagnose and treat as well as take care of the patient from a nursing standpoint versus a medical standpoint.
Yeah, and I'm right when I say that we are a bit of an aging population. I believe 56% of people in Michigan are 35 and older. And while 35 doesn't seem young, it doesn't take long to get to the next step, right?
Correct, yes, yes.
All right. So what would you say the most important thing is about what you do?
The most important thing is really bringing care to the patient. Our job is really to be here 24/7 for anything that they need.
Really?
Because often they're in their homes, they have difficulty getting out, transportation's an issue, they're worried about slip and falls, they may not have family that live nearby.
Right.
And so they call us for anything they need, and we go see them, from dietitian services, providers, podiatrists, and social work.
Yep. All right. To my left, Jonathan is a Glen Lake Laker, by the way, nurse practitioner. You make house calls, correct?
Correct, yes.
All right. So what does that mean when you go out into the field? What does that mean? What do you do?
There's a variety of things that we can provide to our patients in their homes. We can draw your blood. We can provide x-ray imaging. If you had a fall and you're not sure if something's broken, you're not sure if you want to go to the hospital or not, we can make all those determinations right in your home for you.
All right. NMC is where you went to start your secondary education, or your actually university education. How did you decide to become a nurse practitioner?
I've always been in the medical field ever since I was in high school. I started off as a lifeguard, and I just sort of worked my way up from there. I became a registered nurse, and then I decided I wanted to take it to the next level, and so here I am.
All right. Very nice. All right, Julie, for people who are trying to make the decision if this is a good decision for them, how do they do that?
The best thing is to give a call to the office, mainly because our staff here can explain the services, what it does and doesn't include. We are covered by insurance, which is great. There's not typically much of an out-of-pocket cost. They're also allowed to keep their provider. So if they have a doctor or a practitioner they see in the community, they can keep those people as well and involve us to help.
Very nice. Thank you so much for your time.
Thank you.
All right. Thank you, youngster. I appreciate your time as well. At Chronic Care Management in Traverse City, talking about, chronic care, palliative care, I'm Vic McCarty for My News 26 and My TV 12.